Hi, I am Dr. Dhabaleswar Sahoo, Senior Consultant Interventional Cardiologist, Pratima Hospital, Kachiguda. We are going to discuss one of the most important topics, okay, that is diabetes and heart disease. Last video we have discussed about hypertension and heart disease. Now in this video, next 15-20 minutes we are going to discuss diabetes and heart disease. You know, what is diabetes? Diabetes is just not a disease of high sugar. It is a disease, it is called lifestyle disease. It is one of the lifestyle disease. It is a group of diseases where there is a deficiency of secretion of insulin, or when the insulin body insulin is there and insulin is not acting, that is called insulin resistance. You know, glucose is a normal requirements in body. It is present in our food. It is a normal. It is a most. It is required for energy. So while you take food, glucose will absorb and it will go to blood, and there is a hormone called insulin. It is secreted by pancreas. It should let the glucose to enter our cell, so that glucose will utilize and it will produce energy. But what happened in diabetes? In type 1 diabetes, there is no insulin. There is a deficiency, there is no insulin secretion. So glucose, in spite of glucose in blood, it will not go to cell. And type 2 diabetes, there is insufficient insulin. Whatever the insulin is there, that is not sufficient, and there is a insulin resistance because insulin is not acting properly. It is not letting the glucose to enter the cell. So it is called type 2 diabetes. It is the difference between type 1, type 2. And type 2 diabetes constitutes about 90% of diabetes, and type 1 diabetes is 10%. So why we are discussing about diabetes? Because diabetes is the most common chronic disease, and in world about 400 million people are affected in diabetes, and we are expecting that in 2035 it will go to 6 million. Just imagine, means 60 crores people will be diabetes in worldwide. In India, about 77 people are in diabetes. Just imagine, 17% of total population, world diabetes population are staying in India, means 11% total population. If you find 10 people, 12 people in a year, every 12 people there is a diabetes. Just imagine proud. And diabetes, India is called capital of world diabetes, means 1 in 6 patients in the world who having diabetes, they are staying in India. So it is why in India there is so much diabetes, increased diabetes, because you know India is a developing country with sudden improvement in socio-economic status, urbanization, industrialization, that lead to unhealthy diets, sedentary lifestyle, more stress. So now the peoples are getting more diabetes. 77 million means, you just imagine, if you take 6 patients in world in diabetes, out of 6 patients, 1 patient will be diabetes from India. So this is the problem. This is the it is an endemic diabetes. So you need to do something about diabetes, especially in India. So why we are worried about diabetes? It is a glucose, it is normal requirements in body, because in diabetes glucose will be there in blood, but it will not get absorbed inside the cell. So cell, there is a deficiency of glucose, in blood there is a more amount of glucose. So in diabetes patient, why we are worried? Diabetes patient, if you consider a heart disease, about if patient is diabetes, there is a 4-fold chance of increasing coronary disease as compared to those person not having diabetes. 4-fold. It is not only coronary disease, also stroke. There is a 4-fold increase in stroke, and peripheral artery diseases. The artery, what will happen if there is a increased glucose and deficiency of glucose inside the cell? So what will happen? There is a complication occurs from head to toe, including major blood vessels like heart blood vessel, brain blood vessels, and small vessels like eye, then kidney, then your legs. So about 50% population, those are having low amputations, have diabetes. Because diabetes, that's why diabetes is called, it is not called only sugar disease. It is a disease, it is disease effect from head to toe, including major organs like brain, kidney, heart. Then nerve will be damaged, then will develop ulcer, then legs will be, the legs, this nerve and vessel will damage, ultimately leg amputation. And about in the heart failure also, you will find there is fourfold increase in heart failure if patient having diabetes. So this is not in the glucose disease, it is a disease, rather it is a multi-system disease. So this is the diabetes. So how will diagnose the diabetes? How will know that the patient is having diabetes? So diabetes symptoms will be, there will be polydyspepsia, means there will be excessive thirsty, and excessive urine, polyuria, polydyspepsia, weight loss, this will be there. So if these symptoms are there, so symptoms are there. So these are the symptoms. Mostly also diabetes, those who have having the symptoms and they are having after that also having heart problem, kidney problem, and they will incidentally found to diabetes. Sometimes they will present with symptoms, only the typical symptoms of weight loss, polydyspepsia, polyuria, polyphagia, that is increase thirsty, increase food, weight loss, increase urination, present only 20-30% population. And rest of the population, only when they will land in complication, then will come to know, while doing blood test will come to know the patient having diabetes. So when you will diagnose diabetes, some parameters are there. If fasting plasma glucose, if you do fasting 6 hour fasting plasma glucose, if it is more than or equal to 126, just remember the numbers, 126, then you are more having diabetes. Then post glucose tolerance test. If you will give doctor some, if there is a doubt, doctor will ask to do post glucose tolerance test. They will give 75 gram of glucose, and 2 hours after they will do glucose, this plasma glucose test. If it is more than 200, then you are diabetes. And if you do HbA1c test, they will give 120 days average blood sugar. If it is more than 6.5%, then diabetes is diagnosed. Or else present with the symptoms polyuria, polyphagia, if you will do random blood sugar, if it is more than 200, also diabetes. These are 4 criteria to diagnose diabetes. So we discuss what is the importance of diabetes, what is the incidence, and how can you diagnose diabetes. Okay. Then what the diabetes causes in body? The diabetes, what will cause? It will, the blood becomes more thick. If the sugar will increase, it is becomes blood thick. So more thick means it is gets more cholesterol deposition. So it will, what will do, what the diabetes will do, it will increase your triglyceride level, it will decrease good cholesterol HDL, and it will increase your LDL bad cholesterol. And the diabetes also, it will increase the atherogenic small dense LDL, means although it is LDL cholesterol normal value, but it is a more atherogenic. Atherogenic means it is will cause clogging of arteries in maybe brain, it may be your heart, it may be your kidney. So this will cause, and that will lead to your microvascular, means big vessel damage, means big vessels are heart vessels, leg vessel damage, swan vessels, it will cause retinopathy, blindness, then your nerve problem, peripheral neuropathy, and kidney problem, nephropathy. So how can you prevent this disease? This is just so much dangerous disease. It will cause, rather it will cause more dangerous than HIV/AIDS. This so much endemic disease, so much, because it will like each and every organ, just like your HIV/AIDS infection. And diabetes, it is a non-communicable disease, but means it is not transferred to others, and it is a highly preventable disease. Diabetes, it can be preventable. It is a 100% preventable disease. So what are the risk factors of diabetes? Genetic, race, Indians are more. If genetic means your father, if for your father or mother are diabetes, it is a more chance that you are going to 50% more chance you are going to have diabetes. And increase age also diabetes. This is also non-modifiable risk factor, you cannot help. And modifiable risk factor means those you can modify, those you can change. If you will adopt in early stage, means your sedentary lifestyle, avoid sedentary lifestyle. Okay, because of this sudden urbanization, we are more focused on your work, you are taking lot of stress, work and your targets, but you are forgetting your health. So you should do exercise, proper exercise. So how much exercise? It should be minimum 150 minutes per week, means approximately 35 minutes in a day for 5 days in a week. It is moderate exercise, at least you should do. And for vigorous exercise, you can manage with 90 minutes exercise. Okay, 90 minutes means you can do half this 20 minutes every day. But just remember, if you are doing exercise, it is a minimum exercise requirement. But if you are doing exercise, try to increase it, increase your strength. It's not that it is 150 minutes, minimum 150 minutes, and that should be minimum not more than 2 days gap. If you want to do exercise, if you will do 150 minutes exercise one day, it's not sufficient. You should do regular exercise. You should not skip more than 2 days. Exercise is important. Okay, you can prevent diabetes, and you should prevent the unnecessary junk foods. You know, these store foods, they are having this simple carbohydrate, all the oils, all the this preservatives, they will damage your pancreatic cell, that will cause also diabetes. And third is you have to avoid the cholesterol food, high cholesterol food, high carbohydrate food, simple carbohydrate, this food, it takes complex carbohydrate. Another thing is stop smoking. Only 5 things I will tell diabetes also. One is your healthy diet, regular exercise, and stop smoking. You know, cigarette causes, it contains more than 300 toxins. Okay, they are carcinogens. They will cause the brain stroke, heart stroke, and they are also exposed to, also the patient exposed to diabetes also. Another is your stress, because we are in our competitive target oriented life, you are forgetting about just management of stress and adequate sleep. Because also if you are constantly stressed, there is a sympathovagal disturbance, means there is a excited phase, always the heart, brain, all the things should be in excited state. That's why the glucagon will release more and insulin will decrease. That's why patient prone for diabetes, the person prone for more diabetes. And you have to have enough sleep, at least 6 to 8 hours sleep, quiet sleep. It is not interrupted sleep, it is 6 to 8 hours sleep. And also some patients, in OP I am seeing patients, those are having enough, they are having sleep, they can sleep 10 hours, but sleep they are daytime, they are having sleeplessness. Means you should have adequate sleep. Adequate sleep means that should be proper sleep. It's not that duration of sleep, it is should be quality of sleep should be more. If you are getting daytime, instead of enough sleep in night also 10 to 12 hours, if you are getting daytime sleepness, means you are having most likely after to sleep apnea. That is also more prone for cardiac disease. If you are having enough time sleep but are still feeling sleepy, you should consult a doctor. Okay, these are the things you have to take care of. And another thing is, in spite of if you are having diabetes, so what are the options? It is not the end of life. The thing is, diabetes patient, it should be, since you are more prone for heart disease, kidney disease, you should be more careful for your health. Okay, so first is you have to control the sugar. Means sugar, the HbA1c is there, it should be less than 7. That is the criteria. So you should control, proper medicines are there. Now a lot of medicines are came, because see, the medicine is only is a supplementary. If you will not do this lifestyle modification, what will happen? The doctor will add in medicine, tablets, number of tablets increase. Finally, you will land in increasing insulin. So just remember, the medicines, what are the things are, it is only supplementary. So most important thing is you have to do exercise, you have to maintain your weight, you have to take care of your diet, you have to stop all the things, bad habits, and with medicine, with sugar control. Okay, so most of the secondary prevention, heart problem, you can prevent, you can delay it. Okay, so diabetes patient, they are more prone for having also hypertension, blood pressure. And if the diabetes patient having hypertension, you have to strictly control blood pressure also, because this is a lethargy combination, diabetes, hypertension. This if you have both, there is more fourfold, means this is eightfold increase in heart problem, stroke problem. And see, diabetes patient with the blood pressure, they should be strictly controlled. It should be less than 130/80 millimeter of mercury. Systole should be less than 30 and diastole should be less than 80 millimeter of mercury. And regarding cholesterol management also, diabetes patient, they have to control this cholesterol level more strictly. The triglyceride level, just remember, the triglyceride should be less than 150, the bad cholesterol LDL should be less than 100, and the good cholesterol HDL should be more than 50. Then another thing is, you have to do a regular checkup, cardiac checkup, your eye checkup, and this sugar checkup. You have to do regularly. If you not every 6 monthly, every yearly you have to do a ECG, basic test, ECG, 2D echo, and treadmill test. Okay, so these are things. If the diabetes patient also, I have seen diabetes patient in my OPDs, those are in strict diet control, those are listen to doctors, and those are concerned for themselves and their family. So they are, even if they are having diabetes 20 years, they are just behaving as a normal patient. Everything is controlled. And I have seen other side also, the patients, those having diabetes 1 year, 2 years, they are just neglecting, because diabetes is a chronic disease. If you stop medicine, tomorrow you will not going to get complication, unless otherwise it is 500, 600 glucose. So gradually it will be just like a termites, will be damage your body, whole body, kidney, heart, then your brain, then eyes, retina, then you will land in complication. Then I am telling the patients, just choose life, whether you want to take 2 medicines or 2 to 3 medicine, or you will, if there is a problem, if you will not take 2 to 3 medicine, definitely you are going to have problem. If you not tomorrow, if you not 1 month, you have 2 years. In that case, if there is a heart problem, brain problem, you need to take 10 medicine. So you have to decide. Another thing is, for heart prevention also, somebody is prescribing also, we are prescribing sometimes also low dose aspirin, ecosprin, that is 75. It is because as I told you, this diabetes patient, the bloods are more thicker, they are more like to clog the vessels. So prophylactic ecosprin 75 milli are giving. Those are having diabetes, other spectrum more than 40 years, we are giving also prophylactic. These are the things. So what we will learn? Why diabetes? What is the importance of diabetes? How you can diagnose? Why we are more concerned about diabetes? Why in India diabetes are so much increase? And lastly, prevention and also treatment. If you are having diabetes, you have to control your sugar. You have to maintain your HbA1c less than 7%. You have to maintain your blood pressure less than 130/80 millimeter of mercury. You have to maintain your cholesterol level, triglyceride less than 150, LDL less than 100, good cholesterol HDL more than 50, and you have to stop any form of tobacco or smoking, and healthy food habit and adequate sleep, and also relieve our stress. You can do yoga, meditation, whatever things you do, so that you can prevent both. You can prevent diabetes, you can control diabetes, and then you can prevent heart disease, brain disease, kidney disease, and also low limb amputation. You can prevent all the diseases. Okay, thank you. Some questions asked. Interesting question. C. Ram, sir, you can get symptoms before getting diabetes. It's okay. That is called one is called pre-diabetes. You know, pre-diabetes means when sugar is 126 more than that, that is called diabetes, and 100 to 125 it is called pre-diabetes. So that is the phase that should be targeted. That is the correct time you have to do adequate lifestyle modification. You will get symptoms. Sometimes, as I told, 10 to 20% people, in spite of having diabetes, they will get symptoms of diabetes, typical symptoms. That is, increased thirst, increased appetite, then increased urination, in spite of having young age, other urination, and in spite of not having other urinary tract infection problem, other things. So, in 80% patient, they after we will come to know after they are landing in complication like heart diseases, kidney diseases, dialysis. So this pre-diabetes stage, if there is some symptoms, if they will do test, HbA1c sugar test, you can diagnose it. Okay. Then another question is irregular medication diabetes patient can also risk factor for heart disease? If yes, means what can preventable option we have? Please explain. That is also interesting question, because there is a microvascular and a microvascular complication. Macrovascular ECOPD study, macrovascular means blood vessel, big vessel. Macro means big vessel. Big vessel means your heart vessels, your leg vessels, and your brain vessels. Okay. If you control strictly sugar, HbA1c less than 7, if you control your blood pressure, if you control your cholesterol, so you can prevent this. You can slightly, there is a study that you can decrease the incidence of this heart problem, brain stroke, and the leg problems that is lead to amputation, and definitely you can prevent the small vessel problem, that is neuropathy, nerve problem, kidney problem, and eye problem. If the sugar is controlled, you can prevent this small vessel problem and also delay the heart problem also. It is a preventable disease. If you are always I am telling, prevention is better and more cheaper than cure than treatment. Okay. So if you control your sugar, you can prevent this small vessel complications and also big vessel complications like heart attack and your brain stroke. Also you can delay and also sometimes you decrease the incidence. Another question is, any specific food helps to reduce diabetic cardiac problems in diabetic patients? Yes. So this is the another typical good questions, because see, if you should mind it what you are putting inside your stomach, because stomach is not a dustbin. Okay, whatever you are putting, it will be digested, it will absorb your blood. Okay, so if you are diabetes, try to control your sugar. Means it means sugar. What I have told is, diabetes you will get glucose is normal required. Okay, if you put glucose, it will absorb, it will get to blood, and it should go to cell. Other cell means it should go to brain cell, heart cell. But what happens, because of this insulin problem, maybe insulin resistance or insulin not properly secreting, so it will be there in blood, but it will not go to cell. So if you should decrease your glucose, because body doesn't require so much glucose. Okay, so you should take foods. If you divide your food 5 times. It should take food 5 times. Okay, the food should be, it should be less quantity and should take more frequently, and should contain less carbohydrate like sugar, simple sugar. Just like you just make a habit, you should take tea without sugar. Okay, and you should avoid carbohydrate diets like your rice. You try to take chapatis. Okay, so breakfast you take some idli, and lunch you take some 2 rotis and small rice, and night only chapati. Okay, and take adequate vegetables, green leaf vegetables. Okay, so what it was told that in also diet you make 2 plates. Okay, so 1 plate your normal food and 1 plate put salads, vegetables. Okay, so what you will do, first take the first plate, means vegetables, and you take salads. After completion of first plate you take the second plate. Okay, and another question is, my auntie sugar consistently between 250 to say, this is from last couple of months, please suggest what to do. It is whether it is fasting glucose 250 to 270 means is very high, and you have to do fasting plasma glucose and 2 hours plasma glucose and HbA1c. Okay, so we will see whether which glucose is increasing. If you getting fasting glucose so much high means you have to take metformin along with sulfonylurea, glimepirides. Okay, and you have to do kidney also, whether you have to see kidney whether there is damage or not, because so much fasting glucose 250 to 70 is very high, means it is not control, it is called rather poor control diabetes. You need to more because extra cautious your diet, and also weight, if your weight is more you have to reduce your weight, and you have to take extra medicines. Okay, how then another question, how can you manage diabetes level imbalance? See, diabetes as I told is diabetes, this is fasting glucose should be around 90 to 100, 90 to 110, and post prandial glucose means after food it should be around 140. Okay, and HbA1c, the most important parameter is HbA1c, it should be less than 7. If you control strictly, more strictly glucose, what there is, sugar will be low and there is a hypoglycemia. So either way it is dangerous. Okay, because if you will take one medicine, metformin, some medicine will not cause hypoglycemia, and some, if you are having diabetes for 10 to 20 years, you need to avoid also low sugar also. Another question is, it is from Mani, my mother is a diabetes patient in 20 years, how much frequently visit cardiac doctor is suggest, sir? This is also a good question, because the diabetes patients, as I told, is diabetes patients, they are more prone for cardiac problem, heart attacks. Okay, 5 to 7 times. If diabetes is long duration, is they are more prone. So 20 years diabetes means it is more, it comes under high risk. So if you not 6 months, every 1 year just visit, do your basic test, ECG, 2D echo and treadmill. If you are able to walk, you can do a treadmill test, and fasting blood sugar, postprandial, and you also do RFT kidney test every, if it is not 6 months, every 1 year you can do. And another question is, my father underwent stent for 2 stents. 2 stents are placed 2 years back. He is still smoking, sir. Please suggest solution. How can avoid health problems? See, I can tell you, he is lucky that he is fine after 2 years in spite of having smoking. Because smoking, what will cause? Smoking is it contains nicotine. Okay. While smokes, what will happen? There is a spasm of blood vessels. Means blood vessel will collapse. So what will happen? If it collapse means there is a chance of clot formation. Okay, and it contains also toxins. It will not cause only heart problem. It will cause brain stroke. It will also cause lung cancer. All the things. It contains more than 200 carcinogens. So any form of smoking is is highly, is just like a toxin to your heart and it toxin to your body. So ask him to stop smoking, explain him. If he is not able to quit smoking, there is also some rehabilitation center is there. They will explain, okay. They will also counsel. And nicotine patches also there, nicotine replacement that patches, but it is not going to work out because smoking is a very dangerous. It is not for this heart problem, it is for brain, kidney, everything will affected. Also, more or less old age, this is carcinogen also. It will be exposed to lung cancer. So another is another question is, does you get diabetes through genes? My father is diabetes patient. Yes, it is also there. If your father, it is genetic, because as you know from outside you looks like more your father or mother. So inside will be same only. If your father is diabetes, you are more likely to have diabetes also. It is a 10 to 20% chance that if your parents, one of parents having diabetes, it is 10 to 20% chance you are having diabetes. And if your both parents are diabetes, then it is 40 to 50% you are a chance of having diabetes. It's not like that you are 100%, but as I told you, if you can prevent it, if you do healthy habit, exercise, if you follow this meditation, yoga, stress, adequate sleep, all the things, if you maintain it, you can delay the procedure also. It's not that 100% you are going to have a diabetes. Another question is, Rahman, sir, is it suggestible for going regular checkup even if you follow the balanced diet? Yes, if you are diabetes, if you are more than 40 years, at least you should go for if not 6 monthly, 1 year, this checkup, simple checkup, ECG, echo and treadmill I told you. If there is a risk, you can go for CT coronary angio. And still, if you are not a diabetes, not a hypertensive, still after 40 years also it is advisable to once you go for a cardiac checkup, and thereafter 3 to 4 years you can go for. If you are diabetes still, certainly if you are having sugar control also, you should go for at least 1 year, once in 1 year, this cardiac checkup. Working night shift or sleeping less hours leads to diabetes. It is, see, body is made that the night is made for sleeping, not for working. Okay, because it's not that lights only, it is a hormone. Night hormones, some hormones are secreted because in sleep in night. Okay, some hormones like your insulin, they are more secreted in night, and some growth hormones also. If you are doing night shift, means you are not, it is not sleep is important, it is adequate sleep, and this deep sleep is also required. Because if you are working in night, some hormones those are supposed to secrete in night, they will not secrete. Okay, so excessive, if you want to say is okay, but if you are working for a long time and excessive stress, that will imbalance the sympathovagal. Sympathetic means excitatory, vagal means cooling effect. It will cause imbalance, and that will lead to also different hormonal secretion that may lead to diabetes. What 40 years age person should go for diabetes health checkup? Please suggest. If 40 years, if you are not diabetes, if you are not risk factor for diabetes, and your parents are not diabetics, you go as usual every 3 years or 2 years any diabetes checkup, and after 40 at least once you will go for a heart checkup. Another is question is Pritijika, my grandmother who was diabetes in 20 years got Palais attack recent times. Is it suggestible for cardiac checkups too, sir? Yes, because see, as I told you, diabetes is not only it is sugar disease. It will gradually affect the brain, that is called cerebrovascular atherogenic disease. So it will cause stroke. So already there is a complication. Also, you will go for cardiac checkup also, ECG, echo. Since she is palliative, you cannot go to do treadmill test. Basic test you do, control your sugar, and control your blood pressure, control your cholesterol. Because see, As I told you, diabetes patient, if you are reluctant to take 1 to 2 medicine, and if you think that if you stop medicine, I have to control, I have to continue for lifelong, it is a myth. Because as I told patients, you are taking foods for 3 to 4 times, never you are complaining. And one tablet will not cause any problem. Okay, taking one tablet extra will not cause problem. If sit the risk and benefit, if you don't want to take 1 2 tablets, definitely will lead to complication. At that time, if there is heart attack, brain stroke, you have to take 10 to 15 tablets. Okay, and this is interesting. Sir, please suggest how frequently diabetes patient needs to go for cardiology. As I need repeated, so diabetes patient again, it is depends upon your age. If you are young age and other risk factor, whether you are diabetics, whether you are having hypertension, whether you are obese, whether you are having this cholesterol problem, whether you are having thyroid problem. Okay, if you are having this 1 to 2 risk only diabetes, you can go for heart checkup, simple checkup, ECG, 2D echo, and if you are able to walk, treadmill test. This test you can go, if it not 6 monthly, you can go every yearly. If it is more risk factor, more than 2 to 3 risk factor, then if there is if you don't have symptoms also, you should I think I suggest that every year should go for this cardiac checkup. Because see, diabetes patient, they are more prone for cardiac problem, and they are more like to have heart attacks, acute MI. About 50% patient, those are getting, we are getting MI, acute myocardial infarction. They are, and mostly 50% patient, they are diabetes. Sometimes they didn't know that they are diabetes, and after admitting this hospital, after we were doing test, they are to you are patient and we are coming to know that the patient having diabetes. Sometimes it is 300, 400, because diabetes will not develop in one day. It is a lifestyle disease, it will take at least 3 to 4 years to develop. Okay, so don't neglect. If you are, the last point is, if you are having if you are not having diabetes or you are having pre-diabetics, do follow this lifestyle modification protocol, because this, see, in life job target is also important, but more important is your good health. If you are having good health, you can work for long time, you can achieve any targets. So health is also important, as like your targets, achievements, and all the things. So 5 things, the things I before conclusion I have to end with telling 5 things. I have also used to tell 5 principle of 5: healthy diet, then stop bad habits, relief, adequate sleep, and relief of anxiety, then if you are having diabetes, blood pressure, all the things, then try to control it. Don't neglect, don't make your health, make yourself a guinea pig, don't do experiment with yourself. Take proper advice doctors and take proper medicine. If you are having diabetes also, if you take proper medicine, you can have a healthy life without any complication. Thank you.